Welcome back. You're watching The Fix with me, Karima Brown. My guest today, the Premier of KwaZulu-Natal, Sihle Zikalala. Premier, you were talking about how you are rerouting resources to go to areas where you are, in need. Just take us through what are the places where you are thinly stretched, where you have to actually kind of make new plans and almost, reroute resources to plug holes that have, sprung up as you are confronted with the reality of the surging numbers.
Yes, so we are working in Ugu to establish a field hospital in Ugu Sports and Leisure, which will be up and running this week. We have built the capacity in King Echwayo, which is part of the 6 districts that are highly affected. And King Echwayo will cater for your Richards Bay and your up until your Inkandla areas, but will come down also to KwaDukuza, while we know that some parts of KwaDukuza also are serviced there within Ilembe and partly in eThekwini. So the plan is there. As we move ahead, we have already started planning and developing a plan for vaccination, including starting. Yes, yes.
No, in fact, you were segueing into exactly what I was going to ask. Obviously, you are learning in real time in the field valuable information in terms of putting your infrastructure together for the vaccine. If the vaccine were to be available tomorrow, Premier, in KwaZulu-Natal, what would the existing infrastructure, provide you with? How many people would you be able to reach with the existing infrastructure, and what would you need to kind of lay on in addition to what you already have?
In terms of the vaccine, if it is available, we have already started identifying vaccination centers per district, and we're now going to our local municipalities and be able to say, in this area, this is where we're going to conduct vaccination. And that goes also with the question of, with the plan. As the minister was saying, we start with healthcare workers, so you build capacity where you have lot of population and healthcare workers and frontline workers. You then go ensure that each and every district is covered, and you then go cascade down to municipalities. Before the end of the week, a detailed plan will be presented on how we are going to conduct the vaccination.
Now, Premier, when we were setting this interview up, you were in fact planning to have a press conference today to address the people of KwaZulu-Natal. Give us a preview of what are the issues that you are going to put in front, of your province.
Well, the first is the issue of educational programs, which is to create an awareness about this myth that is all there about vaccination. We will be dealing with that issue, but secondly, we will then deal with the issue of continuous testing and screening programs, because then as the number is increasing, daily you get new cases. We must still get contacts and ensure that contacts are screened and tested. But the third issue we will be dealing with today is the issue of ensuring that the super spreader events, especially funerals, we come together, and we're happy with the response of leaders, especially your traditional leaders and religious leaders. How then now we need to address this issue is to go down and ensure that we follow the regulations and the protocols as put in place. We will, of course, be able to present the updates in terms of stats, the new infections, as well as the fatalities that have taken place.
Now, Premier, it's obviously very challenging for people to live out, their full, authentic lives in a time of crisis. We have cultural practices, we have family traditions, we have community, traditions that simply cannot happen in this time because the pandemic, doesn't allow for it. What is your message to your citizens in KwaZulu-Natal about how they live themselves out as authentic human beings, paying homage to their culture, to their traditions, whether it is their religious ones, their cultural ones, their clan traditions, whatever, rituals they engage in from whichever community. How do they stay true to that but not violate, the questions of the regulations such as social distancing, keeping the numbers down? Because the reality is that whilst we are burying relatives, we are actually creating opportunities for more people to die because we gather in ways that are unsafe.
We would like to appeal and send a strong message to the people of KwaZulu-Natal and South Africa as a whole. We are in a pandemic, and this is like a war. It's a war between humanity, the people on one side, and against the enemy, which is COVID-19. Let us all unite. If government says, let's not be more than 50 in a funeral, it is not that is done because we want to suppress you in your funeral or in the funeral of the loved one. But you need to understand that it is meant to save you and the lives of your loved one, which is important. Don't do this only for compliance, but do it because it is necessary to protect your life and the livelihood of yours and your people around you as a citizen. We are appealing for a joint effort and collaboration, and that's why we are saying the social compact is important in confronting this challenge.
Absolutely. Premier, thank you so very much for your time. The Premier there of KwaZulu-Natal, Sihle Zikalala, appealing for a social compact, acknowledging that government alone cannot instill behavior change. Still ahead, why are so many South Africans suspicious and susceptible to conspiracy theories about COVID-19? Stay with us.